Okay guys, so let's say that we have somebody come in and we're in a massage session, they have some knee pain or whatever, they sprained an ankle, they're having plantar fasciitis or anything like that, that's going to end up being affected from this. Like we talked about, this affects so many different things. So what we can do real quick, is just, is we have this wonderful, amazingly beautiful talus that Anne donated for us, since it's hers. What we're going to do is just kind of assess it. I can just kind of passively see how those range of motions are. Like I can take that calcaneus, take it through inversion and eversion, which you guys remember what that talus does, right? It's just going to glide in there. It doesn't have any muscles or tendons or, attached to it really. So I'm just kind of getting in there, checking all those different motions of how it glides. And if there's anything tight, of course I would go figure out where that's at. So we know from the way our structure and function is, if there's no muscle attachments to the area, but yet it's restricted, where are we going to go? Well, that's when we put our thinking caps on a little bit. If you see somebody with like really high arches like I have, you're going to notice that the foot is pulled up a little bit like this, which could really cause, some rotation and different position of the calcaneus relatively to that. So I might say, wow, it seems to go this way just fine, but coming out is pretty hard. I might, just get in here and do a little bit of some myofascial release in here to get a lot of this fascia underneath here, as far as like the tibialis posterior and a lot of those muscles that come down. And so with the foot, I want you to kind of think about, how I'm releasing it. Not so much just looking at the area, but think about how it all goes together, right? All of these foot bones need to be gliding over each other and feeling really good. So I might just come in and hold this for a few minutes, and that's oftentimes too, as I'm kind of just holding this tissue and releasing it, clients might be like, wow, that really hurts, So we want to kind of back off and just stay in communication with them and how that feels, and start out slow. And really kind of I find that a cross-hand release, what I'm doing is I'm grabbing and then just pulling the tissue apart in this way, using the tibia to help me kind of separate some of those layers of tissue, right? Because we've got all kinds of musculature coming down here, and since everything we walk on is flat, it tends to get glued down a little bit. So as we're releasing that, I'm kind of just doing a one-handed fascial release and using the tibia to kind of help me separate those tissues, because you've got all those muscles and all those compartments coming down here, and that's an easy way to kind of superficially and even a little bit deeper to release those. It's going to help you with some of your retinaculum that come around here and help keep the tendons in line. So that's a great way to start out with somebody that's pulled up this way and really driving that subtalar joint in here. Now another thing I could do, which is very common, is if you have strong fingers or not, whatever you could use, this doesn't take much pressure. I'll just take some lubrication, and since this is really pulled up here, I want to give those proprioceptors a little bit of some input as far as releasing the tissue. So I could come in here with my thumb and just kind of sink down on the tissues and start bringing it down in this direction. Now this is really bad body mechanics, I get it. It's just I'm trying to do this so you guys can see. What I typically do is I would be standing up, on the other side and bringing this down, or even with my fingers coming down. In fact, some of the larger, like the NFL players I've had to work, and I've had to use my elbow in there, but still, of course, staying within their tolerance level and having their guidance. So we could really pull all these tissues down here to really open this up. Even sometimes the medial gastroc head or the soleus getting a little bit tight, to open that up. And then, but more often than not, if that's tight too, then the peroneals are going to be tight as well. So you're going to see a lot of people, right, with these muscles come down, there are different attachments here in the third metatarsal and underneath here, underneath the foot. You'll want to get in here and really open those up too. In fact, all of these, the tibialis anterior and all their extensor muscles and friends down here that run down and attach to the toes, you guys know from our other trainings that's their main job isn't just dorsal and plantar flexing. It's actually because they morph up into the IT band and the glutes as they decelerate transverse plane motion through the pelvis. So You'll want to get an elbow and really kind of get in here, you know, and get this opened up or clear the fascia different ways to really clear that. And because down here, right, there's not a whole lot of stability in the ankle that happens from the foot muscles. It's all this stuff up here. So, you know, sometimes I'll get underneath there and get those gastrocs apart, pull it down, get all this cleared. Or, you know, the easy way to do this, honestly, guys, if you just get your foot in there and start feeling where that talus goes from, you can really feel like, wow, where do I need to go? As I'm pushing this up here, I don't feel it gliding forward as much once I get to this range of motion or calcaneus stop. So I would probably turn her over and spend a lot of time getting those gastrocs to separate a little bit and work more independently. And her soleus to really clear a lot of this out. Then of course you can go into the foot and, you know, as Ann was talking about that spiral, just take her foot through that spiral. Inversion and eversion, and you'll find all kinds of little tight areas in there. Like I can get right down in here underneath her foot, as she says, right? As I'm getting here to release one of these metatarsal bones down here, there's a lot of tension in there. So if this is really tight here, if this isn't flattening out when she steps down and allowing the foot to widen, right? As we start here, it gets wider and wider. It's kind of like 1 bone, 2 bone, 3 bone, 4 bone, 5 bones as it comes out. If that's really tight underneath here and she goes to step, the foot won't spread, and that's going to inhibit the talus's little rotation down, and then the tibia's not going to be able to glide down as well either as she moves. So anything's pretty much fair game, right? Because remember I said, any of these little metatarsal heads or these bones, you know, they don't move at all. The cuneiform bones, any of those guys that you feel there's a little bit of restriction in, go get it, because that's going to add up to a lack of function in the foot, which is going to travel right up the body. This is the most important place in the body to have cleared up. So anyways, hands-on goes, get in there, feel that talus, see how it glides, see everything glides around it. So we're going to stop here, and I just want to remind you guys that anything in here, here, or in back is fair game, obviously, but just remember, when people hurt their ankles, and a lot of times their foot, you know, it's because they turn an ankle or they come up short and, you know, doing a back flip or something. I see with a lot of X Games athletes, they really just jam everything back and they're affecting that talus bone. But where the failure really was there was for the inability of these muscles up here to decelerate that motion in the foot. Most of the time that's going to be your problem. So if you've got an ankle issue, you're going to have to go up here and spend a lot of time getting this fascia opened up, especially if somebody has broken their talus, because it's one of the few bones in the body that doesn't have the blood supply coming from up in the body. It actually comes from below and kind of back in, so it's a really, really slow healing bone. If somebody's been in a cast for a long time, you know, whether they had a surgery, broke a foot bone, whatever, if that subtalar joint is not working for a while, it's going to get gunked up in there. So we need to go get all these muscles unstuck that haven't moved to repair and get that motion restored in there. So that's some really great stuff for you guys to think about when your clients are on your table. And just remember, it's always great to go through those embodiments that Ann did, because you really understand what those bones do when they're standing up. That way, if somebody's saying, oh, well, I'm standing here, when I bend forward, or if you're doing some motion assessment, when you see them push their knee forward and this knee isn't coming forward as much, you can pretty much bet a lot of times that subtalar joint is not gliding forward. They can't get into dorsiflexion. I see that with knee problems. I see that with athletes who are trying to get down and load to explode or jump, or even guys that are trying to do their squats properly. I will have to train this to really glide, and then suddenly their hip joint moves a lot better because it can actually load into dorsiflexion. If you shut down dorsiflexion, nothing else is going to work properly, you know, in a functional type movement. So anyway, we're going to cut here, and then I'm going to show you a few things that I do standing up to help release that fascia and restore that motion. Okay guys, so what we're going to do now is we've done all of our table work, and now we want to do some stuff standing up. And this is really important because, You know, there's so many articulations in these joints and this fascia that you can't get to it by hand, and just stretching it isn't enough, right? We have to address the functional aspect. So we're going to get our clients up and really just have them go through some dorsal and plantar flexion, and then we're going to take those movements that Ann showed you and we're going to kind of magnify those a little bit. So what this is going to do is get the fascia, the ligaments and everything to loosen up, so there's so much cartilage and ligaments around that talus, right? There's nothing that attaches to it, but it's got a lot of coverings. And then we're also going to kind of retrain the body on its job here. We're not aligning bones, we're not adjusting bones, we're not doing any of that. All we are doing is making sure everything's doing its job so we can release that fascial tissue, and that's going to change everything all the way up. So what I'm going to have Ann do first here is I'm just going to have her kind of drive into to some dorsiflexion here. So as she comes in, remember the first movement that movement she showed us, I'm going to take the calcaneus and I'm going to take it into eversion. So I'm going to grab it and take it this way, and then I'm going to take the talus in the opposite direction, right, this way. So it's going to be kind of a motion like that. So just go ahead and drive forward. And this is very light. When I'm doing this motion, I'm just kind of accentuating the movement, giving it just a little bit of force to really kind of release that tissue and those ligaments. This is also going to turn on her proprioceptors, and her brain's going to go, oh yeah, that's my job. So I'll do that 10 or 12 times, and then I'm going to take the next motion. Remember, she comes forward as that calcaneus is going to windshield wipe her out. So I'm going to take it that direction, and I'm going to take the talus in. She's doing the same thing. We're just going after the different motions, right? So this foot is taking the calcaneus in this direction, and the talus is going like that. How's that feel?
Great.
Good? So we're just working with all that subtalar joint. All its directions are turning on. It's remembering how to work. Oh yeah, we're really getting some, I can feel some nice deep releases in there coming loose. That's outstanding. Okay, now we had one more motion. Remember, she's going to come forward. The calcaneus is going to kind of ride up, and the talus is going to do the opposite motion. So we're going to mimic that. Sorry my hand's in the way, but that's the best way to release this. So I'm taking this down and forward. As she comes forward, I'm doing that motion. I'm taking the talus this way. So as she goes, I'm just doing that. Okay, so I've got the talus and the calcaneus. How's that feeling, babe?
Yep, good.
Outstanding. Yes, and once you do this a couple times, you really feel their bodies start to figure out and remember the motion, and that fascia, all those tissues in there just really start to lengthen and get hydrated. It's just like we're taking our bones back to school for their job as all this fascia releases. Outstanding. Okay. How's that feeling?
Amazing.
Yeah, so do me a little squat forward on your knee now.
That's
like amazing dorsiflexion, right? That's why this type of work is so powerful. So let's take it to the other part of gait here. Is she's just going to come up a little bit like this, and now we're kind of doing our opposite motions, right? I'm going to take the calcaneus in the inversion, I'm going to take the talus in the opposite one. Put a little bit more weight on here, a little bit more weight bearing if you can. There we go. Excellent. And now we're going to take the calcaneus and we're going to rotate it this direction like the windshield wiper. Now we're going to take it the opposite direction and take the talus with it in the opposite counter nutation there. There we go.
That's nice.
Outstanding. So that's really helping, just getting that whole thing. I can really feel in this plane of motion, right? Because everything is changing angles. There's a lot more fascia and cartilage that needs to go. Very nice. Okay, now we also have in this frame now the calcaneus is going to go down and the talus is going to go this way in relation. We're just reversing everything we did when we were doing dorsiflexion. So I'm just pulling that all down, getting nice gaps in there. There we go. Okay, so see how that feels now.
That's great.
Yeah, you can really tell that. So look at how much dorsiflexion here. She's somebody that's amazingly flexible already. But the great thing about this is you guys that have taken like our structural dynamics class, you know how we go through every bone in the body and basically do this because, you know, in true Trunamics fashion, we've got to address structure and muscles, but we also have to get function. And part of going in and using function for real fascial release, you know, we're not pinning and stretching something, that's fine, but you don't really need to do that when you're educating a body part and driving it through. It's much easier on your client, and they're basically getting reminded of what their true joint function is. So take this out. This is a great way to end a lot of your sessions, especially if you've had somebody that's been immobile or they've hurt their ankle or knee, or if they just want to feel better overall. So when you've got something stubborn that's not working, go get these subtalar joints working, and you're going to be amazed at how great your clients feel. They're going to be like, oh my gosh, it's like life-changing. They're going to feel like they're walking on clouds when they leave. So grab a couple friends and try this out and take it to work, and you're going to love it, and your clients are going to love the results they get. All right, guys, see you soon on the next Skills Lab.